Okay? A mysterious blood clotting complication is killing coronavirus patients. One doctor replied that one of his patients had a strange blood problem. Despite being put on anticoagulants, the patient was still developing blood clots. A second said she had seen something similar. And a third, soon every person on the text chat had reported the same thing. Uh-huh. Oh, but did they get the memo that this COVID-19, this SARS 2.0 had been designed and threaded with characteristics of HIV and characteristics of Ebola. That's why I showed you one of the characteristics of Ebola is blood clotting, preventing blood from getting to your organs. It's a large number. 1 month ago, when the country went into lockdown to prepare for the first wave of the coronavirus cases, many of the doctors felt confident they knew what they were dealing with. Based on early reports, COVID-19 appeared to be a standard variety respiratory virus, albeit a contagious and lethal one with no vaccine and no treatment. They've since seen how COVID-19 attacks not only the lungs, but also attacks the kidneys, the heart, the intestines, the liver, and the brain. Now, y'all probably want to ask the question, well, okay, why is it attacking these things, these organs? Well, when you look at the nature of Ebola, you may gain an understanding of why it is attacking those organs. They describe patients with startlingly low oxygen levels, so low that they would normally be unconscious or near death, talking and swiping on their phones, but low oxygen levels. Asymptomatic pregnant women suddenly in cardiac arrest. Patients who, by all conventional measures, seem to have mild disease deteriorating within minutes and dying at home. Not on a ventilator, some of them do, but dying at home. Not on a ventilator at home, dying at home. With no clear patterns in terms of age or chronic conditions. Another reason why the CDC and many of these government and county and state agencies are not tracking all of the demographics. Because when you start looking at all of the demographics, you're going to start developing a trail to the whole truth. But with no clear patterns in terms of age or chronic conditions, some scientists hypothesize that at least some of these abnormalities may be explained by severe changes in patients' blood. The concern is so acute, some doctor groups have raised the controversial possibility of giving preventative blood thinners to everyone with COVID-19. Therefore, an SOS went out to NBA players who had recovered from the coronavirus. We would like to have samples and also some of your blood. We want some of your blood. So, but it flows or turns like gel. And it appears to be the opposite of what occurs in Ebola or dengue or Lassa or other hemorrhagic fevers. But we already know, because you're looking at it on your screen, that one of the characteristics of Ebola, and the writer didn't get the memo, is that it also, in lots of patients, triggers blood clots. That's right, blood clots. So, autopsies have shown that some people's lungs fill with hundreds of microclots. You see, this is how evil these people are. They attack the very essence of life. They attack the blood like vampires. This Frankensteinian killer, this Frankensteinian errant blood clots of a larger size can break off and travel to the brain, to the heart, causing a stroke or a heart attack. On Saturday, Broadway actor Nick Cordero, 41 years of age, had his right leg amputated after being infected with the novel coronavirus and suffering from clots that blocked blood from getting to his toes. You see? But it's a Frankensteinian created killer. But it's a Frankensteinian created killer. Lewis Kaplan, a University of Pennsylvania physician and head of the Society of Critical Care Medicine, said every year doctors treat people with clotting complications, from those with cancer to victims of severe trauma, and they don't clot like this. So if they aren't clotting like this is a phenomenon, a first-time phenomenon here in America. So even patients on blood thinners in the ICU were developing clots. Blood thinners didn't help, which is not unusual in one or two patients in one unit, but is for so many at the same time. Now that is unusual. Next came the clogging of the dialysis machines. Too many of y'all are on dialysis. You worthless eaters. We want to eliminate you, but we want to blame it on a Chinese bat. That's right. This is how evil some of these Dr. Frankensteins are operating in America and elsewhere in the world. The next came the clogging of the dialysis machines, which filter impurities in the blood when kidneys are failing and jammed several times a day. Words of Coppersmith, that this was different. Then came the autopsies. When they opened up some deceased patients' lungs, they expected to find evidence of pneumonia and damage to the tiny air sacs. After all, that is what the CDC told you all, that it creates a pneumonia-like symptom. But they're not telling you all the whole story, y'all. No. They're not telling you the whole truth. In hindsight, there were hints blood problems had been an issue in China and in Italy as well. But it was more of a footnote in studies and on information sharing calls that had focused on the disease's destruction of the lungs.